Hey everyone, and welcome to this explainer. I am absolutely thrilled to have you here today, because we're going to unpack something truly fascinating. Imagine for a second that you're a medical detective, and you're standing right at a patient's bedside. You hear something totally unusual in their chest, this mysterious sound, and you need to figure out exactly what it is, right then and there. No expensive imaging, no waiting for some $1 million MRI machine to boot up. It's just you, your ears, and a brilliantly simple trick that relies purely on the mechanics of the human body.
Okay, let's dive into this. How exactly do you diagnose a dangerous, potentially life-altering heart condition in mere seconds without plugging a patient into a machine? I mean, it sounds almost like magic, right? But as we're going to see, it all comes down to understanding exactly how our internal plumbing works and knowing the right physical maneuver to expose the truth. This is the ultimate diagnostic puzzle, and today we're going to solve it together using just a couple of very simple moves.
Section 1. The heart murmur mystery. Let's find the cause.
Well, every good mystery needs its suspects. And in this clinical whodunit, we're dealing with a mysterious whooshing sound coming from the heart, which is known as a murmur. Meet suspect number 1, our primary biological villain, HCM, or hypertrophic cardiomyopathy. Basically, this is a condition where the heart muscle becomes abnormally thickened. Because this muscle gets so incredibly bulky and thick, it literally gets in its own way, obstructing the normal flow of blood that's trying to leave the heart. This turbulent, squeezed blood flow, that's what creates a very distinct sound. It creates the murmur. But here's the problem. HCM isn't the only condition that causes a murmur. Enter suspect number 2, aortic stenosis, which is another really common heart issue. And this is where the plot thickens. As a general rule of thumb in medicine, most murmurs actually get louder when more blood flows through the heart. More fluid, more turbulence, more noise. So at first glance, or rather at first listen, HCM and aortic stenosis can sound remarkably similar. They are incredibly hard to tell apart just by listening to a resting patient. We need a way to force them to reveal their true identities.
Section 2. The squatting trick. Let's do a physical stress test.
This is exactly where our bedside interrogation begins. We need a physical technique to stress the system and see how the murmur reacts. And incredibly, that technique is simply asking the patient to change their physical position. It forces us to think of the heart not just as an organ, but as a dynamic plumbing system. When a patient performs a simple squat, they're entirely changing the fluid dynamics inside their body. We're manipulating the literal flow of blood just by bending the knees. Let's look at exactly how this mechanical impact plays out in real time. So here is the incredible biological chain reaction. Step 1, the patient squats. Step 2, because the leg muscles are compressing the veins, venous return increases. That means a massive rush of blood suddenly floods back up into the heart. Step 3, because of all this extra blood, the ventricle, the main pumping chamber, fills up like a water balloon. When it fills up, it stretches out, pushing those thickened, bulky HCM walls apart, which actually eases the obstruction. And step 4, the grand finale. Because the obstruction is eased, the HCM murmur suddenly gets softer. It's a perfect rhythm. Squat, fill, ease, quiet. And this brilliantly illustrates the divergence between our two suspects. Remember our general rule from earlier? Most murmurs get louder with more blood flow? So when the patient squats and that massive rush of blood hits the heart, aortic stenosis does exactly what you'd expect. It gets louder. But HCM does the exact opposite. Because that rush of blood stretches the chamber and relieves the pinch, the HCM murmur gets softer. The volume dial literally turns down. Section 3, the Valsalva flip. Now flip it to the counter maneuver. We have one highly effective maneuver, sure, but a good detective always corroborates their findings, right? We need a counter maneuver to prove our theory. Now flip it. We introduce the Valsalva maneuver. I want you to physically imagine doing this right now. Imagine you're bearing down hard, like you're straining to lift a really heavy box or straining in the bathroom. You take a breath, hold it, and push down hard with your core muscles. What do you think that massive increase in chest pressure does to your internal plumbing? Let's trace the exact opposite chain reaction. Step 1, the patient strains, performing the Valsalva. Step 2, because of all that intense pressure in the chest, blood has a really hard time getting back to the heart, so venous return dramatically drops. Step 3, with way less blood coming in, the ventricle empties further. It shrinks down, which means those thick, bulky HCM walls pinch even closer together, making the obstruction so much worse. And step 4, because the obstruction is now tighter and way more turbulent, the HCM murmur gets much louder. Think of the rhythm here: strain, empty, pinch, loud. Notice the stark auditory contrast here. With the Valsalva flip, the HCM murmur gets louder. Meanwhile, because there is overall less blood flowing through the heart, pretty much every other common murmur, including aortic stenosis, actually fades and gets quieter. Same two moves, totally opposite results. This isn't just some cool party trick, this is a definitive real-time diagnostic test right there at the bedside.
Section 4, Why the Diagnosis Matters. Let's talk real clinical risks.
Now, you might be wondering, okay, this is a neat trick of physics, but why go through all this trouble? Why is it so absolutely crucial that we definitively identify this specific biological villain on the spot? So the crucial point is that confusing HCM for a run-of-the-mill murmur can have severe, life-altering consequences for the patient. As the source material explicitly outlines, spotting this unique pattern changes a patient's medical management entirely. Why? Because HCM carries very real, very dangerous risks around physical exercise that other murmurs simply do not. It also carries highly specific risks regarding certain medications. If a doctor misses this, they might prescribe a drug or clear a patient for an athletic activity that could trigger a life-threatening event. The stakes here are incredibly high.
All of this builds into our ultimate clinical cheat sheet. It perfectly summarizes everything we've learned about the volume dial of the heart. When you squat, venous return increases. The HCM murmur gets softer, while aortic stenosis gets louder. When you perform Valsalva, venous return drops. The HCM murmur gets louder, while aortic stenosis fades. It is a perfect, inverse relationship governed by absolutely nothing but the mechanical fluid dynamics of the human body.
And that brings us to this incredibly powerful quote straight from the source text: physical exam still matters. In an era of evidence-based medicine where we are so quick to order complex, expensive tests, this entire dynamic reminds us that we don't always need an immediate MRI or $1 million machine to uncover the truth. The human body is literally designed to tell us what's wrong with it, provided we know exactly how to ask the right questions and how to listen.
Which leaves me with a question for you to ponder long after this explainer ends. If something as basic as a simple physical squat can instantly reveal a hidden, life-threatening heart condition, what other incredible clues is the human body revealing every single day, just waiting for us to decode them without a machine? Thank you so much for joining me to solve this medical mystery and keep questioning the amazing mechanics of the world around you.